Hello, everybody, and welcome to Show and Tell Durable Medical Equipment. We're going to introduce Tammy Dustin again, who's going to walk you through some equipment that you will be using potentially and things that we have in our Durable Medical Equipment Loan Program. So, Tammy?
Thank you, Amber. So this segment is Show and Tell DME. And basically what this symposium is going to touch upon is bring you through some different stages of medical equipment. There is a video that is going to be shown in between. And the first segment is basically going to take you through basic bathing aids, basic mobility aids. The second segment that we are going to have is going to show a hospital bed, patient lift, and then from there, the third segment will go into different types of wheelchairs, manual wheelchairs, a recline wheelchair, and a tilt and space wheelchair with a little bit of complex seating. The last segment will just be going over through some basic functions of a power wheelchair with tilt recline feature, a power elevating leg. And then once that video ends, I will take questions, further go into some information on some maintenance, winter maintenance in the New England states on how I can get you information on that. And we will move on from that. So enjoy the video. We're not award-winning actors, but we hope you get a lot out of what we were able to put together for you.
Okay, thank you, Tammy. Just wait until, here we go.
Hi, my name is Tammy Dustin. I'm President and CEO of Heron & Smith Medical. Welcome to the next segment of the ALS 2021 Symposium, Show and Tell DME. Hi, this portion is going to be focusing on bathing and hygiene products and basic.
Uh-oh. Can't hear it.
Well as the cover. It's foldable, so if you need to.
Nope.
The next item is a transfer bench. This is if you do not have a roll-in shower, but have a tub to where you need assistance getting into the tub for safety reasons. The transfer tub bench will go on the outside of the tub and then will allow you on this one, which has a sliding seat, to slide over into the tub. Commonly, the transfer tub benches are one seat, and you would have to physically lift up to transfer over. This is a sliding seat model. Again, the legs are adjustable, and the handle here, depending on your tub placement, can be taken off from this end and then transferred over to that end for whatever placement you may need. The other item for shower is a shower chair, which you can get them with a back, without a back, with handles, without handles. They come with swivel seats again, or the standard, which is placed in the tub and would look similar to this. Again, adjustable legs to accommodate whatever height you may need. The last item on bathing hygiene would be, initially, if you're not ready for a commode, would be a raised toilet seat. The raised toilet seats come in different heights. They also come with arms or a clamp, and this merely would sit on top of your toilet. Lastly, if you do need an aid in a bathtub or shower, they do have suction grab bars that are available, as well as the wall mounted for outside of the tub. Some other useful aids is a reacher, which would allow you, if you need to get into a cupboard, which is very handy, or if you're in a chair, to be able to reach something on the floor. Another item is a gait belt. This allows a caregiver or family member to put this around you to be able to lift you up safely for transfers, pivoting into a chair, wheelchair, into bed. For forms of mobility, you have your Rollator Walker. Hand brakes are here. While you're walking, you brake it here to hold the wheels. The Rollator Walker does come with a back padding. It has your seat, and it also comes with a convenient little bag underneath to hold some items for you. The other type of Rollator Walker for more outdoor is the Nitro. This has the larger caster wheels, is really good for outdoor, small trail, walking with maybe a gravel surface if you don't have pavement. Again, it has the larger caster wheels. It does have the basket in the front, hand brakes. This locks it to brake. Adjustability in the handles here based on your height. Seat here, and it's really easable to fold up. So that concludes our segment for walkers and bathing and hygiene aids. Thank you. Bill.
Hi, welcome back to another edition of Know Your DME. I'm Gary Goslin. This is Eric Koval. Today we're looking at a setup Drive Delta 1000 full electric bed. We're just going to run through the options real quick, and we'll go from there. What we have here, these are rails. They're designed to keep the patient from falling out of the bed. They lower and they raise. Right now they're fully up. There's a little lever here. Lift the lever, rails drop right down. Now the patient can transfer out of the bed, or they can be adjusted. Put them back up, lift the lever, pull the rail up, let it down. Perfect. Now they're up completely. We're going to move on to the functions of the bed. On our semi-electric beds, raising the bed height requires this key. This key here is usually located right on the bottom of the footboard.
Okay.
The semi-electric models raise the floor height with a key like this. The key like this goes into this little locker here. So I can come around and see this. There's a slot for the key, designated like so, goes right into here. And this raises, when you turn clockwise, it'll lift the bed height. Counterclockwise will lower it down. You can see here that the bed has raised up about 1.5 inches. Generally, when I set beds up in patients' homes, if they have trouble transferring from bed to chair, a lot of times I'll set the bed height to the chair height, so it makes an easier transition to and from. On this model here, this is our full electric, so we don't really need this. So we'll close this back up, put it right back into here. And there it is, stored for good keeping. Now on our pendant functions, this is a 6-button function. This top section of buttons is going to run the head frame. So you're going to lift the head frame up, and you can see that it comes up nicely. And for better showing, we're going to actually put a little weight on it just so you can see. Eric, you mind getting on the bed for me? Okay, we're all the way down. Well, I got you on the bed. So when I'm in a client's home, I like to find out whether they're left-handed or right-handed after I've set the bed up. So you're right-handed. Okay, so luckily the pendant's already on your side. I'm going to have you actuate it, and I'm going to show you how it goes. This top section here, this is going to run your head frame. So this is up, this is down. Go ahead and push one of them for me. Push the up. Okay, so that function shows how it can elevate a patient's back, neck, and head. Go ahead and lower it back down. That's this button right there. Perfect. The next set we're going to do is we're going to raise up the foot frame. And that's located on the second set of buttons, designated right here. Okay, you want to go ahead and raise up the foot frame for me? So that's going to bring the foot frame up like this. It's going to help ease tension off the legs, off the waist section. Go ahead and bring that back down. Awesome, thank you. Because this is a full electric bed, the bottom set of buttons here, this is going to raise and lower the whole height of the bed. So why don't you go ahead and raise, this one here raises up, go ahead and raise it up for me. Now you can see he's pushing the button, you can see the whole bed is actually lifting up at a level height. Excellent. Can we go ahead and bring that back down? Just a side note that a lot of people miss, these rails are not to help you get out of the bed. They're not designed to help you sit, pull, they're just designed to keep you safe inside. And that does it for the dry full electric bed.
Go.
So this is our divided leg sling. There's different types of slings for picking the patient up for transfer or for hygiene purposes. Okay.
Go.
I've asked Gary to simulate being a patient so we can demonstrate how the lift is when it's actually in operation.
Go.
So now I'm just going to go over the basic lift with you. You have locking wheels for stability purposes. Not all lifts will have these locking devices. Okay. The remote control. This is an electric lift. There's different kinds. There's a manual lift, which doesn't have any of these power options. But in this one, I'm going to hit the legs open, and they're going to open for stability purpose. Okay. Once those are open, you can proceed to lower the boom, also on the controller. And then once hooked up, once you put the patient in there, you can raise them. At which point you can move the patient around.
Go.
going to simulate actually picking up a patient. I'm going to bring this over, center mass of the patient. At the moment, I'm going to lock the wheels. I'm going to start hooking up the sling. Each caregiver or nurse will have their own way of doing this. So let them teach you how to do that. Come around to the head, hook up the shoulders. Lift up just a little bit. A lot of times they can't sit up, so you have to do it. You have to bring the boom closer. These ones on the side are just for added, so we're going to put one. All right, so now we're all secure. I'm going to lift the patient up. As you can see, the patient is lifted off the bed now, at which point I'm going to slowly just move him so you can see. I'm going to lock the wheels. I'm going to take the remote. I'm going to lower him back into the bed.
Go.
This also functions basically the same way. It's just a hydraulic lift. It's a manual patient lift. Again, this model has locking wheels. To open the wheels, instead of pushing the button, you're going to bring this arm down. You're going to swing it open. Sit it right back up so nobody bumps into it. Then you have the manual hydraulic piston. It opens and closes, whichever function you're going to do, up or down. And then you pump the piston. When you're ready to lower the patient, there's this little lever, the valve here, and you just kind of feather it open until the patient starts to lower. Now, because it's a pressured piston, the patient will never just drop. But you want to feather it, kind of find the sweet spot. Close it when they get to that spot. Hi, I'm Eric. This is another edition of Know Your DME. This is a manual wheelchair. This is a pretty basic setup. We have your footrests, they swing in. On another chair, I will show you elevating leg rests. This has brakes on each wheel, on each rear wheel. We also have the function on this chair is a flip back armrest. Push this button here, it'll flip back, makes it easier for side transfers. Unlock the wheels. The patient seated in there, and we're good to go. The next chair I'm going to show you is a Recline manual wheelchair. Of course, different features again. This one has also flip back armrests, just like that for side transfers. Different style of brake. Right here. These are elevating leg rests. You put the calf pad down, your foot on it, and you can raise it. So you can put your leg outright for circulation. You just release it and bring it right back down. The backrest is actually the recline feature. Pull the handles and you can bring it down. You can stop it in different positions all the way down to flat. Okay. This is our more advanced tilt and space wheelchair. Different functions on every chair. Start out with the footrests. You can put a heel loop back here, and it would wrap around here, so the patient's foot doesn't slide backwards off of it as you tilt. We're going to go around the back here, show you the pedals. They don't always have pedals. There's sometimes handles. This is your brake. So you press that. Now there's no movement, especially with a person's weight in it. This one is the release for the tilt space feature. I'm going to push that, and the whole chair just tilts in space.
Hi, I am back briefly to discuss seating and positioning on complex manual wheelchairs. On the complex manual wheelchairs that Heron & Smith provides, they were individually designed for the clinical needs of the patient. On this specific model on the tilt in space, they all would require a headrest for head support. This headrest is adjustable. These are adjusted to the client's needs. There are many more options out there. The hardware would adjust it accordingly as what is needed for the patient. The backs on complex manual wheelchairs are individualized based on the patient's needs as well. This is just a basic back with a contour with some lateral side supports. You'll notice the two different pads to just showcase that some clients do have individual needs for right or left lateral for leaning. Lastly, they would all come with a customized cushion based on the client's needs at that time. Majority of these are skin protection, or they can go into pressure relieving. These again are the basic components. There are several more components that may be added to a chair as needed.
This is a basic power wheelchair. Again, customized to everybody's individual needs. I'm just going to go through the joystick a little bit with you, forward, backwards, left, and right. This is the joystick. I'm just going to go over the basic functions. You have your off, your toggle switch down, on. You got speed control, which is turtle is slow, rabbit is faster. Mode and profile goes to different speeds. In just a minute, I'll show you all the positioning features. I'm just going to go through the features of the chair now. This has an elevate feature, brings you straight up so you can still reach for cupboards. As you can see, I'm going up. I'm going to go down. This has a tilt feature, just like kind of the tilt space. It just lays you backwards for pressure relieving. Go right back down again. This has a recline back. I'm going to show you that. And then I can control the footrest. They can go outright. Of course, right back in. In closing, I just wanted to reiterate the fact that each of these chairs is built customized to the individual's needs. With the tilt and recline feature, generally there's a headrest behind me.
Great, thank you. So as you know, when you make films, there's bloopers, so please excuse those. So basically, I hope you were able to get a little bit out of the equipment shown. A lot of times we do get asked about winter conditions in New England. There's a lot of different information out there as far as for power wheelchairs, manual wheelchairs, your terrain. So at the end of the presentation, I do have my email. Please feel free to reach out with chair information you have. If you cannot locate a manual that would have come originally with your chair, and I can certainly get you out a current manual and just some charging tips for power wheelchairs and general maintenance for your medical equipment, manual wheelchair or power. In closing, I just want to really thank you all for allowing us to be part of the symposium. Please access the medical equipment loan closet in all 3 states. It's a very valuable care services that Care Services provides. Also, access the Quality of Life grant that is offered through the Northern New England chapter to help offset potential expenses for medical equipment or equipment that may not be covered by your insurance. And lastly, visit our virtual booth or contact us directly with any specific questions, concerns, one-on-one conversations specifically about your insurance and what they may cover and what they may not. Use us as a resource. And again, thank you and enjoy the rest of your day.
Thank you so much, Tammy. That was very enlightening. I'm trying to see if we have any questions, and I don't see any questions. So I think that we are good.
Okay, great. Thank you.
Thank you. Okay, everybody. Karen is going to come on and give us some tips on the, there she is, gamification and the expo area.
Wonderful. Thank you, Amber. Well, I hope everybody has taken note that there is an expo this year. It is mostly like a poster display, although there are a few videos there as well. The theme is Together We Can Help Each Other Live Fully with ALS. And toward that end, you can enter the expo. And if you visit 2 booths and take 2 actions, from downloading a document, taking a call to action like signing up to be an ALS advocate, signing up for the focus research that you'll be hearing about this afternoon, then you will be eligible for door prize drawings that will be pulled this week and this weekend and announced on Monday. We have a wonderful assortment of 3 door prize bags with ALS Association items and items from Vermont, Maine, and New Hampshire shops that will help you keep comfy this winter. So we really hope you enjoy this Together expo, because 2 by 2 we can do it. And have a great time. The expo will be open for an hour after we wrap up this afternoon.
Thank you, Karen. And we are going to take a short break for lunch. And we hope to see you back here at 12:30. We have some great guest speakers on presentations for the afternoon. And we are looking forward to continuing our symposium. And thanks to everybody.